And with us on the telephone this morning, we have the Imperial County Chief Executive Officer, Tony Rouhotas. We have Devin Anderson, Deputy Director, Imperial County Department of Social Services, and Karla Flores of the Area Agency on Aging. Good morning.
Good morning.
Morning.
Good morning, Ms. Buckley.
Mr. Buckley again. We're going to have
That wasn't me this time, Carroll.
Okay. We need to get an update. What is happening? And we're going to get it from three different directions. And Tony, let's start with you. We have on our website, in our news this morning, that you have a committee looking at, ways to reopen Imperial County. Where does that stand?
So what that stand is, we're just drafting some documents now to start preparing for the reopening of Imperial County as we move forward. I think we need to be ahead of this and start making decisions based on our situation as we move forward and make those determinations of how businesses can be open, when they could be open, maybe restrictions, or either keeping certain restrictions and still or expanding on the availability of the business to provide services, whether it's additional curbside service. We're working on variations of it. Our first step this week is you'll see that the county is going to be reopening our county parks and also allowing for outdoor activities such as golf to take place. That press release will be going out this morning. It'll talk about the opening of, be able to use tennis courts, golf courses, outdoor activities. I think we all need to be cognizant that moving forward, we have a lot of people that have been pretty much cooped up inside their houses, but we need to have that behavioral health component and let them go out and burn off some steam, get some exercise, and this is just a way that we can help assist by letting that happen.
Okay, and the committee is comprised of whom?
So right now we have 2 board members, and this is just the committee for the county itself. And that's 2 board members, myself, and a couple department heads. And what we'll be discussing on Tuesday is an actual committee to start to reach out to the cities and community groups that can help spearhead this as we move forward. We recognize it's just not the county involved in this, it's the cities, nonprofits, it's our chambers. It's going to be a very large, diverse group to help get this going, but at the county level, we're just making the determinations now of who's directly involved on the county side. Okay,
and just to shift gears a little bit, revenues way down, and they're going to stay down. Is the county looking at considering layoffs, furloughs from people that, right now really don't have anything to do?
Yeah, so we're not deep into those discussions. We're looking at all avenues. Revenues are something we are looking at. I met with the team internally on the county side yesterday to start discussing that. One of my main concerns was looking at property tax and meeting with our tax collector, Karen Vogel. Our numbers actually for property tax are in line with where they should be, which was a positive thing to notice yesterday. But we all know that on our sales tax is down for this quarter, and that's something we're concerned about, and we are keeping our eyes on.
Okay, sales tax makes up a big part of the general fund, right?
That's correct.
Okay, we'll let's go over and let's talk to Karla. Good morning, Karla.
Good morning.
Okay, Area Agency on Aging through the Public Administrator's Office and everything. You've got your hands full, don't you?
We sure do. And the Public Administrator and Area Agency on Aging are operating as usual. The only difference is that we're taking clients by appointment. And you might say, why are we still operating? Well, our department is a very unique department in our county. We pretty much what we do is we assist our older population, which is our most vulnerable population. Therefore, we need to continue operating and making sure that our services are being delivered during these difficult times. Our agency has a variety of service that are free of charge to older adults over the age of 60. One of those services are legal services, which provide legal assistance to seniors and their caregivers. We have respite care services for seniors and their caregivers as well. health insurance advocacy, medication management, transportation, information and assistance, long-term care ombudsman program, nutrition consultation, and our meal program.
Okay, the meal program may be one of the more visible, and I know you're working with a number of other agencies and organizations in that area, right?
Correct. There has been a drastic increase in our meal program ever since the COVID-19 hit. In the past, before COVID-19, we were serving about 250 meals a day. Now, on a regular day under COVID-19, we're serving 588, almost 600 meals a day.
Okay.
These meals are prepared through Catholic Charities and delivered in the whole entire county.
Now, if somebody needs more information on that or needs to know if it is available to them, they can contact you, right?
They can contact our office. Our number is 442-265-7030.
Okay. And did I miss anything?
I could share a little bit more about the meals, just in case if anybody out there is listening. So we are serving meals in Calexico, Heber, Holtville, El Centro, Imperial, Brawley, Westmoreland, West Shores, Ocotillo. As the numbers increase, we realized that we needed help. Catholic Charities is doing such a great job, as well as our volunteers that we have through the National Guard. But we realized that the time was going to come where we were going to be needing assistance. When we talked about it, 2 local businesses reached out to us to assist us. So we just recently brought on board Rosa's Restaurant from Calexico, which they are delivering 74 meals to the seniors in Calexico. And in the city of Brawley, we brought in Brownie's Diner, which they are serving a number 97 seniors in the Brawley area.
Okay. And this may not be in your area, but I got a call the other morning from a senior who was concerned about a face covering. And, who can I call? Who can give me a face covering? And, you're not necessarily providing them, but what we stressed to her was all you need is a bandana, a handkerchief, some sort of a face covering, and practice social distancing. You do not need a medical-grade face covering.
Correct. One of the things that we ended up getting a donation from a nonprofit organization in the city of Calexico Wellness Center. They provided about 60 masks that went with each meal to the senior. So at this point, we do not have any masks in our office, although we do have relief bags that have toilet paper, water. What else do they have? What else do they have?
Towels, hygiene.
Oh yeah, a hygiene kit and a little arts and crafts so that our seniors can keep themselves active. Okay. But at this point, we still don't have masks.
Well, and as we pointed out, you don't need an N95 mask or a medical-grade mask, just a face covering.
Right.
That will work. Okay, Devin Anderson, good morning.
Good morning, sir.
And let's find out, Department of Social Services, essential, because maybe now more than ever, because of the number of people that are in need of a hand, information, or being pointed in the right direction.
Absolutely. We continue our services at the Department of Social Services, even if we have offices that are not necessarily open to the public. We can still call in. We can make appointments over the phone. Many of these services continue without interruption, and in fact, our mandate from the state is many of our programs are not to discontinue, ensuring that the medical coverage through Medi-Cal and the food stamp benefits through CalFresh continue without interruption. Because we've not discontinued these services, we actually have seen a decrease in applications because people are not being discontinued and they're in having to reapply. So we're continuing on. Our caseload sizes are growing based on exactly what we're seeing in the economy right now, with a lot of people who are either laid off or been released from work. They are coming to our offices and they're getting housing assistance through the Cal Works Cash Aid program, and then of course the purchasing power to buy food through the CalFresh program.
Okay, two very important programs, and you have other programs that can help people with, let's say, a utility bill.
Well, our primary programs are mainly just the cash aid, the food stamps, and the Medi-Cal. But the cash aid is geared towards the family. So as a family with children in the household, when they apply, they don't have the income. Of course, they receive those benefits to be able to help with their utilities. But if that isn't covered enough, or if they need additional assistance, then we can refer them to those agencies like the Clínicas de Salud that will be able to assist with their utilities. Okay.
And if I need to come by the Department of Social Services, is it walk-in or are you by appointment?
By appointment, and all of our programs can be accessed by phone nowadays. We can do the interview, we can assist with completing an application online. Applications can be dropped in our mailbox out in front of the offices. Those are picked up 3 or 4 times a day so that we can make sure that we get on top of those applications as quickly as possible. Right now, new applications are processed within a matter of 2 to 3 days.
Okay. We appreciate the information. Tony, did we miss anything?
No, I think we got it. Oh, yeah, you know what? Let's have Karla discuss a little bit about scams. We want to make sure our community is aware of
scams
going on.
You mean sir. There are unscrupulous people that would try and take advantage of us during a pandemic?
This is the best time for them to do this. So one of the things that I would like to add before we end this is that there has been numerous people going out into our community. Our seniors are the most vulnerable population, therefore elderly individuals are the most frequent targeted for fraud scams during these difficult times. We've been hearing, well, we haven't seen it, but there's been individuals going out into our community, triggering senior apartment complexes. These are the most vulnerable populations, so they go in there. Why? Because they're lonely, willing to listen, and they trust. They're more trusting than younger individuals. So these fraudulent medical staff are going out there soliciting testing for COVID-19 and any other medical necessity that a senior might be needing at that time. We currently are seeing physicians and medical imposters that are going door to door offering COVID testing. Not only are they dangerous to our senior population, but they're also extremely dangerous to our healthcare industry. So one of the things that we want to let our community know is to be very vigilant when you're seeing somebody out there. We know that there's no doctor that's really going out door to door, taking lab work testing, asking you for your personal information such as Social Security, Medicare, any type of insurance, credit cards, your bank statements, anything like that. So one of the things that I would like to encourage people is to be alert if it's a stranger knocking on your door offering your services, and please make sure they identify themselves with an ID, business card, any information that they might have from the company that they're with. Do not respond to any free offers. We all know that nothing is for free. So when they go out there and telling you, we are providing you this test for free, charge, just provide me with your information. Well, that's the key to it. Once you provide that information, you know it's not for free, because they're going to charge your health insurance or they're going to charge your bank. Do not respond to any free offers. Do not provide any personal information. Make sure you're constantly checking your medical statements and your bank statements for any inappropriate transactions. Do not share your personal information again to anyone with that's not trustworthy, such as your provider. What else? If you see anybody out there, just make sure that you report it to our local law enforcement agencies.
Don't just let it ride, and just be very, very cautious, very wary of anybody that comes in smiling through their face covering, offering to do this and do that for free. Just give me your bank account number. And that online and telephone scams and now door-to-door, just be very cautious, right?
Right.
Okay.
I think Devin has one quick update.
Okay.
Yes, just a minute or two here. I know that there have been a lot of questions concerning our efforts in the community for the homeless population that we have. The Imperial Valley Continuum of Care has received a lot of funding to help this specific population, and we have formed a homeless task force with a hotline. The hotline number is 442-265-0211. And through this homeless hotline, anyone who calls in, they, depending on their need and depending on their risk at this time with COVID, they may be able to qualify for housing, either in a hotel or otherwise. And they can also qualify for other wraparound services where they can be put in touch with agencies like behavioral health, the public health department, and AAA, as well as the food bank. So we've got that homeless hotline out there, and I just kind of didn't want to let that one go before we wrapped up today.
Okay. We appreciate all the information. And again, Karla Flores of the Area Agency on Aging, Devin Anderson, Deputy Director, Imperial County Department of Social Services, and Tony Rouhotas, the Chief Executive Officer for Imperial County.
Hey, Carroll?
Yes, sir.
Hey, just one thing. I want to thank you for letting me invite Karla and Devin on the air today. They're just a couple of our true heroes working behind the scenes, and I really want their words to be heard because they're doing a ton of work for the community, and they have a whole team supporting them as well. So it's truly important that we let their voices be heard and kind of brag a little bit about everything that they got going on. I appreciate that.
Okay. We appreciate the visit, and we'll talk again next week.
Thank you very much.
Thank you.
Coming up, another great mix of oldies. 12:30